Hello and welcome to Talk Truth. My name is Corey Huntsberger. I've got my father, Alan Huntsberger, in the studio. And Dad, we're going to start off with our foundational verse. The earth and everything in it, the world and its inhabitants belong to the Lord. For he laid its foundation on the seas and established it on the rivers. Psalm 24, 1 and 2. Foundational because it's true, right, Dad?
Absolutely, it's true. Let me give you one example. We hear this carbon tax, carbon. We got to get rid of carbon in the air.
Yeah.
The thing that I like about spring the most is when I'm walking through the woods, green leaves are popping up all over the place. And you see that when you're driving down the road or whatever, it's alongside of a hill, green leaves are coming out. I love the green leaves. Why? Because the green leaves eat the carbon that's in the air, and then they make it into oxygen. So I'm walking in the woods, breathing fresh oxygen and thanking the Lord for his creation that he made that takes the carbon out of the air and makes it into oxygen and transfer it into oxygen. And the plants grow on the carbon. Now, take the carbon out of the air and the plants can't grow. So man's trying to, sound very scientific, but he's not. He's really out to destroy the planet when he thinks of carbon tax and we got to get rid of the carbon and we can't have any carbon. Wrong. Carbon is what God created, and it's a beautiful thing when you understand it. There you go.
Well, I never thought I was going to get an education on carbon, but there you go. That's awesome. I agree with you. Fresh air, it's always good to have. Let's bring on our guest. We're excited to have him. We got Mr. John Carpay, and he is the founder of Justice Center. And John, welcome back to the show. Appreciate having you on.
Very glad to be with you guys.
John knows about carbon.
Oh,
he
yeah,
understands that.
It's plant food. It's plant food. And Canada's federal government has officially listed it as a pollutant. And it's insane. It's a naturally occurring. Without it, the plants and the trees die. And of course, if vegetation dies, everything else dies with it. And
right.
We've listed plant food, namely CO2, as a pollutant. It's absolutely insane.
It is. Thank you, John.
How come we know that, but they don't know that?
They do know that. But the problem is the mainstream media and other people use the propaganda, call it a pollution, and everybody just accepts it. Or less and less Canadians, let's put it that way, less and less Canadians are beginning to accept what they're saying and understand what we're talking about. We're talking about the real science and exactly what it's all about. Breathe that fresh air because God has given you great air. And in the spring, we have more brand new oxygen because we have new leaves.
Yeah. Well, John, the reason why we had you on is because Justice Center just came out with a new report, and it's basically the costs of the lockdowns and the damage that was done. That's really what we wanted to talk about, because there was incredible damage done that is unseen damage. You know what I mean? Basically, like it's there. And I say unseen because the mainstream media is not covering it. No one's talking about it. But the damage has been done, and I wanted to give you the time to talk about kind of what some of your findings were, and we can have a discussion about that.
It's a very comprehensive report. It was put together by our research coordinator, Ben Clausen. He spent many hours. It's an easy-to-read report. It's written for lay people, but it's also quite academic. There are citations to dozens and dozens of sources, most of them government sources. The government's data itself tells us that the government's policies were harmful, or at least there's a strong suggestion. We, as you know, correlation is not causation, right? Just because two things are happening at the same time doesn't prove that one is causing the other. However, we do have shocking data. I'll start with mental health, that in 2019, before lockdowns, 67% of Canadians assessed their own mental health as very good or excellent. right? So 2/3 of the population are saying they're in very good or excellent mental health, is now down to 54%, just barely over half. That is a huge drop. Now, can we prove absolutely that that was caused by lockdowns? No, we can't. But it stands to reason when you consider how it was illegal to have Christmas dinner with your own mother. It was illegal to gather in person with friends. And there is plenty of scientific research and medical studies showing that human beings need in-person contact. Those studies were done and completed and available long before lockdowns were imposed in 2020. But the scientific research tells us that we absolutely have to, for optimal mental health, you need to connect with other people in person. And it's not good enough just to be relegated only to phone and Zoom, even though they are good tools that help us to keep in touch. But we need the in-person. And that was illegal for years. And so that took a big toll on the mental health of Canadians, and we have not yet recovered.
You know, John, I would say that, when Canadians were going through it, a lot of them understood that, right? A lot of them understood that this was not good and we need to stop it. But a lot of them then got fined or even charged. And I don't know, I'm just assuming some are still in jail because of this hullabaloo. You would know more about that than anybody because you folks have been fighting for people that have really been charged with things that really aren't true. Is that not correct?
We've defended hundreds of people who over the course from 2020 onwards who were charged with violating these utterly unscientific health orders, and it's been mixed success. We've had people that unfortunately were convicted and had to pay a fine, but we've also had lots of successes where we negotiated withdrawal of the charges and the Crown's withdrawn charges. We also had a court victory recently from the Ontario Court of Appeal, the second most important court in the country after the Supreme Court of Canada, actually ruled that Ontario's policy of totally banning any outdoor protests in Ontario was illegal even for two people to meet up together outdoors for a peaceful protest. And so we got an Ontario Court of Appeal ruling that that was an unjustified violation of the Charter freedom of peaceful assembly. So yeah, we have pushed back. The results have been mixed, but there's been some successes, and I think the whole situation in Canada would have been much worse if there had been no resistance and no pushback. And the real heroes are the people who put their lives, well, they didn't put their lives on the line, but they took great risks by not complying with unscientific, charter violating health orders. And a lot of people have paid a very high price, but they practiced courage, and that's to their credit.
Well, what about the WestJet case? Have you been following that one of the WestJet employee suing because they lost their job because they wouldn't take the COVID-19 vax? What do you think about that one?
It's nice to see. It's like we're turning around a corner, because in 2021, 22, 23, the court rulings were overwhelmingly negative. And I think that's because, as I've explained in my book, Corrupted by Fear, I think a lot of judges were corrupted by fear. They bought into the false media narrative that COVID is an unusually deadly killer, which the government's own data tells us is not true. COVID was certainly deadly, but it was not an unusually deadly killer when compared to other seasonal flus. That's not my opinion. That's the government's data. But now we're in a phase where a lot of that fear has gone away. And so judges and human rights tribunals and so on are in a better place to actually look at the evidence and think. And so I think we're turning a corner on the court rulings. So it was really good to see this WestJet employee being vindicated And I believe that was the Rebel that issued a report on that.
Yeah. Let's get back to your report, because the first thing that we mentioned was the mental health decline. And by the way, I don't think we know the full effect of that, because I think there's kids that missed their proms. There's kids that were locked down and having to do homeschool for 2 years. What did they miss? All the interactions. I think that's going to be a major issue coming up in the future, and we'll do more of a deep dive on that. But I think second one was really the rise in opioid-related deaths, right? In the report you found?
Yeah, it was tragic. In the first year of lockdowns, there was a 72% increase in drug overdose deaths. 72% increase, a huge spike. And again, somebody could say, well, correlation is not causation. It was just a coincidence that after lockdowns were imposed, drug overdose deaths rose by 72%. But I think that's preposterous when you consider that people were driven into forced isolation, leading to, or at least increasing, loneliness and anxiety. People forced out of work. It was illegal to socialize with other people. It was even illegal to gather peacefully outdoors. We've defended people across Canada that were issued tickets for participating in a peaceful outdoor protest, and so nobody should be surprised that we had a 72% increase in drug overdose deaths. Now, after lockdowns finally went away, and the lockdowns, vaccine passports are behind us for the most part, but now we're with a situation where in 2024, after lockdowns were over, the rate of drug overdose deaths was twice as high as 2019. So this wasn't just like a spike that went up and then lockdowns were lifted and we went back down again. It wasn't like that. We went up and then we went down a little bit. But right now we are at twice as many drug overdose deaths as pre-lockdowns. So this seems to be permanent damage that lockdowns have inflicted on society.
Do you think it's just lockdowns, or is it also people understanding that our government isn't as, how would I say it, honest,
friendly,
and friendly,
loving,
and cares for the Canadian people, like maybe most Canadians thought they were?
Well, this is a key point you raised. The government's, under Canada's Constitution, when a government passes a health order, vaccine mandate, a lockdown policy, any law or policy or health order that violates our freedom of association, which these orders certainly did, or bodily autonomy, mobility, freedom of expression, religion, conscience, anytime that the government violates a charter right or freedom, under the Constitution, the government is required to put forward cogent and persuasive evidence to show that this health order is actually bringing about more good than harm. And in order to do that, you need to do a cost-benefit analysis. There's not a single government in Canada, neither federally nor any province, that has conducted a thorough cost-benefit analysis of lockdown policies. So it's been left to the Justice Centre, and other groups and think tanks as well have done research in this area. We're doing the research, with our limited staff. We're funded by voluntary donations. We've got 24 staff Canada-wide, including lawyers, paralegals, researchers, whatnot. So a small nonprofit funded by voluntary donations with 24 staff across Canada. We're doing the heavy lifting on analyzing the lockdown harms, which is work that the governments, with their massive resources, their multi-billion-dollar budgets, their tens of thousands of civil servants, they haven't done this work. They didn't do it at the relevant time when they were imposing lockdowns. They still haven't done it. Well, we're stepping up to the plate and doing it, because under the Constitution, it's the government that is required to demonstrably justify any law, policy, health order, vaccine mandate that violates charter rights and freedoms. So this is part of holding the governments to account and saying, hey, look, the lockdowns did a lot of harm. You still haven't bothered to really look into it, but we're putting this out to the public. because it's important to know that these policies were very harmful, very destructive.
Yeah, agreed. Let's talk about the next key point that I found was fascinating: healthcare system and the strain on the healthcare system and kind of what happened there.
So Canada's got one of the worst healthcare systems in the world if you measure the value received for money spent. Canada spends more per person on healthcare than just about any country in the world, depending on which study you're looking at. We are first, second, third. We're at the top of the list in terms of our spending. It's huge. When you look at our wait times for cancer diagnosis, wait times for surgery, number of doctors per capita, number of nurses per capita, number of hospital beds per capita, number of acute care or intensive care units per in relation to the population. We got terrible outcomes. And this has been a long-standing problem. I mean, there are tens of thousands of Canadians die every year on waiting lists, waiting for medically necessary surgery. What happened during lockdowns is that the government and the media establishment pretended that COVID was causing these long-standing problems in healthcare. Having said that, the lockdown certainly did make things worse. Here in Alberta, we had our chief medical officer, Dina Hinshaw, canceled over 20,000 surgeries for no reason, because supposedly the hospitals were going to be flooded with COVID patients, which didn't happen. Hospitals were largely empty in March and April and May of 2020 because the media terrified everybody into being so scared of COVID that people who did not need to go to the hospital after, say, getting a heart attack, they didn't go to the hospital. The hospitals were empty, and still tens of thousands of surgeries were canceled. And anyway, the government really pushed this position that our healthcare problems were caused by COVID, which is not true. Our problems with the Canadian healthcare system have been around for decades.
Mm.
You know, one of the things when that COVID was going on, I happened to see that firsthand. I walked into the hospital to go visit a friend. I have a medical badge, and so I have access to the hospitals in the same way as a staff member does. And so I went in, and of course, the hallways and everything else was empty. It was amazing how quiet it was. And went in, he had a private room. I visited him for about an hour. When I came out, the hallways were packed. Like you could hardly walk down the hallways. And I looked into one of the rooms. They had emptied the rooms and put everybody in the hallways, and found out that there was media present. And so
I believe you.
that's what they were doing. They made it look like the hospital was overloaded and overcrammed and visited, but the rooms were empty. And so it was disgusting, absolutely disgusting. And now I've been in the hospital, and my granddaughter's been in the hospital. We find out that we have a hospital system. We spend more money in Alberta, for example, in healthcare than anybody else. And we have hospitals crumbling by non-repair things that they aren't spending money to repair. We don't have the money, and yet we're paying the most of anybody else. It's horrendous what's going on. And yeah, it's depressing, to be honest with you, because we've been bragging in Canada about, oh, we have this great healthcare. Well, I know of friends in the United States that their hospital rooms are luxurious compared to our hospital rooms.
During the lockdowns, the government kept on pushing, and the government-funded media kept on pushing this false message that hospitals are overcrowded, and it was true for some hospitals some of the time. But I remember vividly we would get photographs from nurses and other healthcare workers saying, here's the Rocky View today, or here's the South Calgary health center, at such and such time, and there's nobody in the waiting room. And meanwhile, the media are propagating this message that the hospitals are all overcrowded. There was, don't get me wrong, there was some overcrowding in some hospitals at some times. However, that was true prior to lockdowns. Any doctor or nurse will tell you that during annual flu season, the hospitals would get flooded with a whole bunch of flu patients, and it would get overcrowded and they would cancel surgery. That was normal in Canada. And yet the government tried to justify these freedom violating and very damaging, very toxic lockdown measures on the basis of saving the healthcare system. When again, we'd had these healthcare problems for a long time.
Yeah. I just wanted, you said it briefly, you kind of said it tens of thousands, but I wanted to, the stats I found was since 2018, over 74,000 Canadians have died while awaiting surgery or diagnostic care, with more than 15,000 deaths occurring in 2023, 2024 alone. That is an arena full. 15,000 people died between 2023, 2024, waiting.
Well, and that's because of people like Dina Hinshaw and other chief medical officers who, across the country, tens of thousands of surgeries were canceled. This is in a context where even when lockdowns were brought in 2020, we had Canadians dying on waiting lists. You know, this is part of your patriotic sacrifice to serve the God of equality, which is equal misery. And so you die on a waiting list. It's sort of a patriotic Canadian thing to do. But this got even worse because the chief medical officers canceled tens of thousands of surgeries, which again is totally unnecessary. And so that exacerbated the wait lists. And I don't know if in 2025, if our wait lists, if we're back down to the 2019 levels, which were already a problem. So we need to have a little bit of humility and look at what France and Germany, Japan, Singapore, Australia, New Zealand, there's all these countries that have a mixed private-public system. And, of course there are probably things to be learned from the United States as well. But if we don't want an American-style healthcare system, which is what Canadians say, well, okay, great. Let's look at why and how France, Germany, Italy, and Spain are getting far better health outcomes from their healthcare system than what we are in Canada. And there's this lack of humility where we pretend that it has to be the status quo in Canada, or we have to adopt a US system. That's a false dichotomy. There are lots of healthcare systems in the world that are working far better than Canada's. And we need to acquire some humility and take a look at those models and implement the positive aspects from them.
Yeah, and I don't want it to be lost, the obscene amounts of money we spend into healthcare and still requiring those kind of wait times for surgeries or diagnostics or whatever. And in that time frame, people are dying. And we spend obscene amounts of money. I just want that to get that in the heads of Canadians, because I feel like there is a group out there who are older, who remember Canada back in the day when the healthcare was awesome. We used to be able to say our healthcare was the best. And now it has declined so terribly. It's shocking, and it's really disgusting in my book. I don't know.
Well, speaking of deaths, the other thing that lockdowns have very likely contributed to is this massive increase in assisted suicide. In 2019, before lockdowns, we had something like 5,500 or so Canadians commit suicide within the healthcare system. They call it medical assistance in dying, but I choose not to use that term because it's misleading, because we've already had medical assistance in dying for thousands of years, which is where if you're terminally ill and you're on your deathbed, you get some painkillers. That is medical assistance in dying. What we're talking about here is assisted suicide, which Supreme Court ruling in Carter in 2016 said that it's constitutional right to kill yourself and to be able to ask for assistance in that. So in 2019, we had 5,500 assisted suicides. In 2023, that was up to 14,000. So 2.5 times as many Canadians killing themselves. We cannot directly measure, the extent to which this was exacerbated by lockdown policies. But again, it stands to reason if you make it illegal to socialize, right, which lockdowns did, it was illegal to socialize in person. You couldn't watch your kids participate in sports. You couldn't even meet outside. Restrictions on religious freedom and so on. It stands to reason that those lockdown policies contributed to that massive increase in the suicide rate in Canada.
Yeah. Well, John, we're out of time. I know there's more in the report about increased crime rates, economic consequences, also the disaster for the youth, the anxiety, depression, all that. I want to encourage people to get the report. Where can they find it?
www.jccf.ca. So that's Justice Center Constitutional Freedoms, jccf.ca. And report can be found there, and it's worth reading.
All right. We really appreciate having you. Thank you so much for everything you guys are doing and for doing the report for people can read. They can print it out, have a copy of it, give it to your friends. Thank you, John. Appreciate you.
Thanks for having me on your show.
Well, I'm so thankful for the people over there at the Justice Center putting that report together. Alan, it's an easy, he's absolutely right. It's an easy read. It's a PDF. You can print it out, hand it out to your friends and family. It really puts things in perspective because a lot of what he talks about are things that you don't see, like the increased crime rate, the consequences, with the economy, with small businesses and stuff, how the, mental health, is leading to the more deaths, kind of thing. And the healthcare system, how it caused more problems and more deaths for people. It was a disaster, an absolute disaster. And not one person has come out and apologized for it yet.
That's right.
We're giving away a free booklet called The Living Stone, A Journey of Transformation. It's yours absolutely free. Get it. It's going to help you increase your relationship with Jesus, hear his voice, become more like him. You can go to our website, gotalktruth.com, click on resources, fill out the form. We'll send it to you in the mail, absolutely free. You want to help support our mission and keep this conversation and truth on the air? We are viewer supported. We don't take government funds or special interest groups. We are only funded by generous viewers like yourself. You can go to our website, gotalktruth.com, click on donate. There's many different ways you can give digitally. If you prefer to give by mail, you can. You can make the check payable to Heritage Christian Ministries Association and send it to 246 Stewart Green, Southwest, Suite 3260, Calgary, Alberta, T3H 3C8. And if you'd like prayer, you can call toll-free 1-800-915-0056. All right, Dad, we're out of time. We'll see you guys later.
Love you.